For couples struggling with infertility, assisted reproductive technologies such as IVF offer a chance to realize their dream of becoming parents. But concerns have emerged after some applicants seeking coverage for the procedure under the Social Health Authority reported being asked to provide marriage certificates as part of the approval process. SHA has since termed the requirement an administrative error, but not before raising questions about access to fertility treatment and whether marital status should play any role in determining eligibility. Helen Aura with the details.
Mary Kanini, not her real name, recounts the emotional highs and lows she has endured over the past month as she and her partner eagerly awaited the chance to finally become parents.
I saw a poster made by Teachers Service Commission on their page on 24th April 2026, which said that teachers who are unable to conceive together with their partners can visit the Nairobi West Hospital and get the service paid for.
For years, Mary has struggled with infertility after numerous consultations, tests and treatments. She believed she had finally found a solution through in vitro fertilization, commonly known as IVF.
I did 2 HSG tests, which confirmed that my fallopian tubes are blocked. I've also been diagnosed with PCOS. This is a polycystic ovarian syndrome. And for those 2 reasons, I am unable to conceive on my own.
However, after undergoing the required medical assessments in a Nairobi hospital, the hospital informed her that before the IVF procedure could be approved under the Social Health Authority, she needed to provide a number of additional documents. For future purposes, please attach online to the pre-authorization request all the supporting clinical documents required, case notes justifying admission and procedure, radiology and laboratory reports, certified medical report from a gynecologist or a fertility specialist, then send the patient to SHA headquarters with the following documents for verification: marriage certificate or affidavit, and a national identification card. Mary says one of the requirements came as a shock.
We've been together for 3 years, and 3 years is a long time trying and failing. So we have not really thought about marriage yet. It's not even one of those things I would say is a priority right now for me. A baby would be a priority right now as we speak. I feel it is discrimination.
The requirement has raised concerns among couples seeking fertility treatment, particularly those who are not legally married but are pursuing parenthood through assisted reproductive technologies. Fertility treatment remains one of the most expensive medical procedures for many Kenyan families. Upon reaching out to the Social Health Authority CEO, Dr. Mercy Mwangangi, she termed the requirement as an administrative error. And I quote, "That was an administrative error that will be sorted immediately. We do not ask for marriage certificate for you to access IVF. When you are registering, the standard procedure is for you to produce your identification documents. So for a principal member, we only need the ID." To reiterate, Health Cabinet Secretary for Health Aden Duale told the Nation Media Group, and I quote, "SHA wishes to clarify that a marriage certificate is not a requirement for accessing IVF services. The reference to a marriage certificate in the communication was made in error. The hospital is advised to resubmit the request through the appropriate verification and pre-authorization process for review." Under the comprehensive Mwalimu cover, which provides inpatient benefits ranging between 1.3 million and 3 million Kenya shillings, SHA is expected to cater for up to 600,000 Kenya shillings towards IVF treatment costs. For Mary and her partner, they now cling on to hope, determined that they will get a breakthrough as they continue with their journey towards parenthood. Helen Aura, NTV.